All right, good evening, everyone, and welcome to ATP Live Monday. I am Bemi Sola Boyde. I hope you can hear me. Let me just increase the volume. This is better. All right, so welcome to ATP Live Monday. How has your Monday been so far? Okay, not too busy. All right. So ATP Live Monday is a program where you get to ask any questions that you may have about the health of your children, and you get immediate answers live from her pediatrician. So welcome. Once again, I'm going live from my page because we see having issues with Facebook. It's been really a battle with Facebook with all the AI challenges, and unfortunately, for those of us that run a medical group, it's a little bit tricky helping Facebook AI to know what is for medical illustration versus what is pornography and all that. Anyway, but we'll keep doing what we can with as long as we have the platform. But I hope if somebody who is working in Facebook is listening to me, they just really need to have a relook at some of other groups. You can't just leave everything to AI. AI is not that smart as human beings. All right. Anyway, welcome to ATV Live Monday. I am Gwemi Salaboide. So please help me to share the video. Share it to your friends, to family members. That just share. If you have any questions about the health of your children, this is the time for you to ask your questions, and we'll try and answer them. So feel free to ask any question. Okay. So welcome. For those on Instagram, I can say you're welcome. For those watching on Facebook, good evening, Prince Romeo. You're welcome. Nice name. Um, just trying to share the video myself and make sure that everybody can see and everybody can hear. And I'm just going to try and pin them as well to our groups, because right now we can't go live in the groups, and then we can't also go live as Ask the Pediatrician. So it's really something else. But at least let me just make sure the video is in our group and I can pin them so that people can see them. So welcome everyone. This is the last Monday of February. I mean, this year is just running. I can't believe we're already coming straight to the end of February already. I mean, that's just so fast. But I hope you've been having a wonderful year so far. You've been learning a lot. So, welcome to ATP Live Monday, which is a program where you get to ask any questions that you may have about the health of your children in the next 60 minutes. And I will do my best to also answer them in 60 minutes. I just want you to know that even if you cannot, if you're watching the recording or you're watching after the live session, you still have questions, that's not a problem. We actually have our Facebook group that works all week long from Mondays to Saturdays, and you can ask your question on our groups on those days. So that's not a problem at all. Feel free to always ask your questions on the Facebook group any time of the day, any day of the week. The only time you may not be able to get us to um, you may not be able to get answers to your question is usually on our on um, on Sundays. Other days of the week, you are welcome to ask your questions and get immediate answers live. So thank you so much for joining us. So I'm just doing all the pinning and all, which I think I'm done now. I'm still trying to see whether people can see my live. Okay. Yeah, why is it not showing me pinning? Okay, anyway, I'll just leave that. Okay, so let me go back to the studio. So if you have any question, feel free to ask your question now. I can't see any questions yet on Facebook. Let me go to Instagram. No, I can't see any questions yet. So feel free to ask your questions now and we will try to answer them. Remember, we have 60 minutes. Now it's down to 54 minutes. So feel free to ask any questions that you may have about the health of your children. We answer them live on Mondays, but after the live session, which is between 6 p.m. to 7 p.m., West African time. You can always still go to our Facebook group. You can post your questions and we'll answer them. We used to also have the anonymous post button, but again, like I said, we have a lot of issues with Facebook and our group, and somehow the anonymous post button has disappeared. So for now, while we're still trying to sort it out, bear with us and just post your questions, post whatever you are comfortable to post with your name, and we will answer them. And but on our other groups, we still have anonymous post button, but we won't be able to answer children's questions on those groups. But if it's for your own personal health issue, you can ask on ATP Family. So that is just about that. And on Thursdays, we do our teachings. Last week, Dr. Lolade, who is a consultant oncologist, it gave us a talk on early signs of cancers in children and what we can do and how to manage them. And I think many of us have learned from that. If you have not watched that, you can still watch it again. It's still available on all our pages and all our platforms. So go ahead and watch them. So every Thursday we do a teaching on something relevant, something important about health of our children. So that is for Thursday. And so this Thursday I'll be taking another important topic we have done so far this year. We talk about epilepsy. It's always amazing to me how many children, how many parents have questions about convulsions in their children, and they have no clue how long they need to be on medication, whether the medication is going to. I mean, it's just so amazing the level of ignorance about something that very important, So I did an update on epilepsy, and I hope if you have not listened to it, please listen to that. And we've also talked about fussy eaters because it's also one of the most frequently asked questions. And we talk about the principles of how to manage a child who is fussy with their eating. So I also encourage you to look at that. And I think Dr. Peju Oyerindewo, who is a consultant ophthalmologist, has taken a topic on the common eye conditions in infants, and she talked about conjunctivitis, red eyes, and stuff like that. You may also want to listen to all that. So we are here to just make sure that you getting health education and information. It's just your partner in making sure you're raising healthy children. And just to let you know that Ask the Pediatrician, beyond what we do online, we also do a lot of stuff offline. And I'm sure some of you have seen us in your sorry, my water is falling. Some of you have seen us in your community doing outreaches in the schools, doing community outreaches. So we don't just stay online, we also do a lot of stuff online. Anyway, I'm saying all that while I'm waiting for you to ask your questions, which I can't see any questions now. So feel free to drop your questions and I will try and answer them before my time is up. So right now I don't have any questions. So I hope people are not dropping their questions on the group. If you're on the group, please to ask your questions, you need to click on the video because that is the only way I'll be able to see your question. If you leave your questions or with or just on the the shared uh, post itself, I won't be able to see it. I won't be able to see it on StreamYard in my room here. So you have to make sure you are putting your question directly under the video that is showing my name, I mean, that is where I'll be able to say it. So let me just check on the groups to make sure nobody is dropping questions and I can say it. Okay, I don't think so. Oh, okay. Oh, thank you, Mr. Felicia. I shared it to super parents. That's nice. Thank you very much for sharing. I hope it's not me that did the sharing. Okay, I didn't overstep my boundaries. Okay, okay. So feel free to ask your questions now. Still got a few minutes. Okay, I'm just checking on the videos to make sure that nobody is dropping their questions in the wrong segment and I can't say it. But if you have your questions now, feel free to ask and I'll be happy to answer them. All right. So I understand that it's Monday, so many people are still busy and trying to settle in. Welcome as you're joining us. Welcome to ATP Live Monday. The program is Ask the Pediatricians and it's a live session. So you can ask any questions that you have about the health of your children and we'll try and answer them. It's brought to you by Ask the Pediatricians Foundation. On an Ask the Pediatricians Foundation, we're committed to the health and the welfare of all children globally, but most especially in sub-Saharan Africa, in Nigeria, where most of our children are still dying from preventable causes, things that we can treat, things that we can prevent. So we want to make sure that we bridge that gap in terms of health information to ensure that parents, we don't lose our children to things that are completely treatable, things that are completely preventable actually. So that is what so this on Facebook, let me know. You can share your comments. I hope there's nothing wrong with my with my Instagram and my Facebook because I guess it's the longest I've ever waited for anybody to even drop any questions. So that's fine if there's no question, but I'm just hoping there's nothing wrong with people's ability to post questions on the group. All right. Okay, so while I'm waiting for the questions to come, I just like to talk about the importance of seeking health care promptly. We do, by virtue of what we do on ATP, we get loads and loads of questions every day. And one of the questions that normally amazes me is when people ask, "Oh, should I go to the hospital? Should I not go to the hospital?" And I always like that kind of question is a little bit tricky because I felt we should know when we need to go to the hospital. You don't even need to be asking. And let me just say, my default position is if you ever need to ask that question, you know what you need to do is you actually should just go to the hospital. If you ever needed to ask, should I go to the hospital? Should I not go to the hospital? Just go to the hospital. The reason is that it's better to go to the hospital and they tell you there's nothing wrong with your child and they send you back home. Even though it look like you've wasted your time, but it's not a waste of time. At least you are more confident when you come back home. So I always say that if you have any reason to ask that question, just go. Your doctors will be happy to see you and they'll be able to happy to send you back home and reassure you if at all there's something wrong. All right, let me answer the first question I have from Sonia. Thank you, Sonia. Good evening. I'm in the process of stopping breastfeeding. Okay, well done for breastfeeding so far, 16 months. Not too bad. We want you to go for 2 years, but it's okay. I understand. 16 months you've tried. But if you can go the whole mile and go 2 years, we'll be very happy. It doesn't take milk from cup or strap bottle. Is it okay for him to go without milk for some days at this age? Okay, number one, your child still needs milk at the age of 16 months, even 2 years, even up to 5 years, children needs milk because most of the calcium and that children needs, they get it from milk. So children will always need milk. We want children to still take milk until they are 5 years old. However, after the age of 1 year, They don't need to take breast milk. They can actually take cow milk, but if possible, if you can make the breast milk up to 2 years, that would be perfect, but if not, even from 1 year, you can give them cow's milk. However, I think the issue most parents are struggling with is how do you give the milk? So the fact that your baby does not drink milk does not mean the child can still not take milk. So you don't have to always drink milk. You don't always have to drink it from the bottle. You don't have to drink it from a straw, anything. No, you don't always have to drink milk. There are many ways of giving children milk without drinking it. They can lick it if you want. Give them powder milk. It's okay to lick. There's nothing wrong with that. You can use it to cook food for children. So when you make your cereals and you add milk to it, and they eat it with the cereal like that, well, whether it's the pap or whether it's all these other corn-based cereals or whatever, or you know what I mean, you can, that is still taking milk. You can give children smoothies. So smoothies is another way of giving milk without necessarily drinking milk. So you blend your banana, your fruits, and add milk to it. That's a lovely way to take milk without necessarily drinking the milk. You can give children pancake. Pancake is made from milk. Any food that you make from milk, that child is still getting the milk. So don't be too restricted in your options of giving the child milk. And this is actually a principle that parents should generally learn, because I noticed a lot of parents, which is one of the principles we also teach during complementary feeding. Some parents struggles with giving their children food, and and one of the things that maybe the child does not eat the food the way you present it to them. So you must find a way of hiding what you need to give the child in the food that the child likes. So it's a very lovely principle. So like now, I've just given you several examples with milk. There are many ways to give your child milk without necessarily mixing it into a bottle or into a cup for them to drink. So they don't have to drink it. Let them lick it. Let them eat it with pancake. Let them take it in smoothies. Let them take it with even the beverages you're giving the child, tea or whatever. Chocolate beverages, you can add milk to it. Most of them already have milk anyway. So those are the options to give the milk. You can use it to cook your food, so, and the child will not even say it. The same thing you can do with meat, so, or chicken, because some children don't like to do it, eat those kind of things. You can blend it and use it to cook, make it into your, let's say you are cooking porridge with jam or something. You'd have blend your fish or your crayfish or your meat, and then you cook it into the food. The child won't even say it, and the child will eat it. So those are ways by which you can hide some food that the child really needs into things that the child will not eat. So it's not necessarily, it has to be liquid drinking milk, but as long as the child is getting the milk, the most important thing is that the child is getting milk. I hope that's helpful. All right, I got a question on Facebook. Philomena, we read too. Okay, good. Should I be worried? My 10 months old can't pull himself up to stand yet. No, I won't be worried. I won't be worried. So standing is an 11 months to 12 months old skills on the average, and that is actually average. So, and we know some children may not stand until they are 1 year old and all that. So everything is not always on a certain bam. Once the child is 10 months, the child must stand. No, some children will do it at 10 months. Some children may not do it at 10 months. Some children will do it at 1 year. So the most important thing is that is the child still within the average range, for achieving that milestone. And is the child, has the child been achieving the other milestones that precede this particular one you're worried about? So I want your child standing by a year. So I won't worry if the child has not done it at 10 months, okay? And obviously your child is bottom shuffling. So that is what you are trying to describe, that your child is moving on his butts. And so some children move with the butts. They don't stand and walk. And sometimes some of those children tend to walk later. because they get so very fast with the bottom shuffling. They don't feel like I need to stand up to do anything, which is completely fine. So we don't worry about crawling. A lot of parents ask me so many questions about crawling. My child is not crawling. Actually, you don't need to ask that question, because we don't need crawling, to be honest, and not every child will crawl. So it's actually a very not relevant milestone when it comes to things. Crawling is actually the most irrelevant milestone, because some children will not crawl no matter what you do. Some children will crawl with their hands and feet. Some children will move with their bum, and some children don't do any of it. They just get up and walk, which is fine. So we don't even worry about crawling, about standing. What I worry about is if your child is not yet walking by 18 months. That is when I'm going to worry. And if your child is actually a bottom shuffler, I'm going to stretch that to 23 months. We actually give them extra time, because we know that bottom shufflers don't feel like getting up to work. But I always tell parents 18 months, so that all of you will come at 18 months. But when you now come, if I notice that is bum shuffling, I may not worry even until 23 months, because we know that bum shufflers tend to work a little bit later, but there's nothing wrong with them. It's just that they are so very comfortable with their bum shuffling that they don't feel the need to try something else that is going to be more inconvenient. And that's why some of you will see children, when they start to walk, sometimes they just like to go back to their crawling, because they find it faster. But eventually they will, when they are more confident with the walking, then they stop going back to crawling. So I hope that is helpful. So Philomena, I will not worry about your child at this time. All right. Okay. Going back to Instagram, Sonia said thank you. All right, you're welcome, Sonia. No worries. That's why we're here. And she's over on Instagram. Good evening, ma'am. My baby is 8 months old, weighing 9.8 kg. Okay, she's right. You've not asked me any question. I always don't want to assume I know what the question is, but let me just make assumption for your own sake. I guess you're trying to ask me whether that weight is okay or not. If that's the question, the weight is perfectly okay. And an average 8 months old actually weigh 8.5 kilos. Yeah, so your child is actually doing very well. 9.8 is actually close to the weight of a 1 year old. So I'm not worried about your child. Unless you are worried that it's way too much. It's not too much. It's on the upper limit of normal, but I won't worry about it. So just keep feeding the baby appropriately. Thank you. And Tricia 158. Tricia 158 on Instagram. Good evening, doc. My 4-year-old was diagnosed with sepsis and was treated with IV and drugs for a week, but his temperature kept spiking. Okay, so is your child home or is your child still in the hospital? You have been stolen vomiting for 2 days, and I need to have a clear understanding, where is this child? So because if your child has sepsis, and your child is treated with IV, I want to assume that child should be in the hospital under the care of one of my colleagues. And so if the child is in the hospital, usually we should not be discharging the child if the child is still having fever. So it is for my colleagues to look at what they are treating the child with. So if they've been treating with antibiotics, the child is still having fever, he said that the drugs are not working. He said that our diagnosis is wrong, or what is. So we have to go back to the drawing table and do, sometimes we have to do what we call blood cultures and stuff like that to know what particular germ we're dealing with, the bacterium, or is it a fungal, is it something else? And then the lab can also help us to know which antibiotic is the most appropriate antibiotic for the child or for that particular germ. And then we can sometimes change, so we can start with something and then we change to something else. So those are the things we can do. So Tricia, I think there was one question: is this child still in the hospital or is this child home? If the child is home, you need to take the child back to the hospital, because that child should not be discharged. And I see a lot of questions like this, and I wonder, why are we in a hurry to send a child who is still sick home? I get a lot of questions, people telling me my child was sick, was giving injection, blah, blah, but the child is still not okay. And I'm like, yeah, but the child should be under the doctor. But it seems sometimes that those children have gone home and they are not yet well. Ideally, we shouldn't be sending children who are not yet well home. So if your child has sepsis and is in the hospital, that child is not going home until the child is at least free from fever for 24 hours. No fever, 24 hours. And I know it's not my doctor's colleagues' fault all the time. Sometimes it is the parents. Yeah, sometimes it's parent, they put pressure on the doctors. Doctor, I need to go home, and we need to go home, we need to go home. So I just want to plead with you now that I have opportunity to talk to parents. Please don't be in a hurry to go home when your child is sick. And I know, yeah, hospital bills can be crazy, and every day, every night you sleep in the hospital, you pay for hospital bed. But it's better for a child to be well before we send the child home. So please be patient with us. Let's treat the child, and we are not oracles, we are not diviners, so we are more like detective doctors. That's actually what we do. So you come to us, you tell us this, we examine the child, we do our blood tests, and we think, oh, it's most likely this, it's more likely that. So we treat the child based on our suspicion. Sometimes we are correct, sometimes we're not, and we have to go back and figure it out again. So that's what we do. So if your child has gone home, Tricia, you need to go back to the hospital. If the child is still in the hospital, you should have this conversation with the doctors treating the child in the hospital, because they are the one that knows a lot more. They know more about that child than you can ever even tell me on a social media platform. All right, I got a question. Oh God, now second, is there any reason why a 5 month old who used to take a combination of formula and breast milk now have a preference for only breast milk? You think you should be asking me that question? Okay, because I will just tell you that your baby is listening to the pediatrician, and your baby knows that breast milk is the best for her, and so the baby now has decided to go with us and do the right thing, because you shouldn't be giving your baby a combination of anything. You should just be giving your baby breast milk only. So I don't think I'm the right person to ask that question, because actually that what your baby is doing is what I want you to be doing in the first 6 months. Your baby should be on breast milk only for the first 6 months, and breast milk is still the best. So if your baby wants breast milk, so what is wrong with you giving your baby breast milk only? Is your breast milk not flowing? Why do you want to give baby formula in the first instance? What we recommend, what the World Health Organization recommends, what UNICEF recommends, NHS recommends, AAP recommends, is that all children should be on breast milk only. And I deliberately like to mention UK and US, because some of us think we are copying people in the Western world and thinking maybe breast milk is only for the poor, for the third world countries. That is not true. Everybody should be on breast milk. Every baby breastfeeding exclusively for the first 6 months of life. So that is what it should be. So I hope so I have no problem with baby being on breast milk only. That is actually what baby should be doing. All right, she's about Concord. Say good evening, ma'am. My baby is 8 months old and weighing 9.8. Okay, she's about you are the one. I've answered your question before. I think you came back. So she had bacterial infection from the blood test carried out. Antibiotics was given. She reacted to it. The reaction gave her blisters. Okay, in the upper and lower limbs. We're given loratadine. Loratadine for an 8 months old. No, 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 no. This baby needs to go. Are you in the hospital? If not, you should be in the hospital, Chisaba, and I will not give a 8 month old loratadine. That is wrong and wrong antihistamine. And not so much of a child who is already reacting to something. So usually children can react to antibiotics, which is why we tell parents not to abuse antibiotics, because you will never know which one your child is going to react to. So those antibiotics your child has reacted to, it has to be clearly written on your child's notes. You must know the name of it, because every time you go to the hospital, you must always tell them not to give your child that particular antibiotics. So they have to give your child a different antibiotic, and then they need to treat the original infections, and they need to treat the blisters in the mouth. Blisters in the mouth doesn't sound like an antibiotic reaction. I may be wrong, but that I hope it is not the original illness that is giving your child the blisters. If you're not in a hospital with a pediatrician, I strongly recommend that you go to a hospital that has a pediatrician, because I really, really think your child needs to be under a specialist care, under people who knows what they are doing, really. So because the fact that they are giving your 8 months old loratadine is giving me headaches, because that should not be given to any baby less than 2 years old. So you really need to go to a hospital where a pediatrician is involved in the care of that baby, and that is very important. So the sepsis is not the issue. The reacting to antibiotics is not an issue. It's something that can happen, but there are medication that we use to treat such reactions. And most important is that we should stop the drug straight away. And once we stop it, we'll give something else, and then the blisters, whatever, should will resolve on its own. So, but you really need to make sure that baby should be under a pediatrician, and we have to be sure that those blisters are not part of the original illness. It's very important, because sometimes people say, "Oh, that blister means the child is reacting." May not mean. Usually, most children when they react, they have rashes, not blisters per se. So they tend to come up with rashes and all that. So I really need you to be sure, and not just make assumptions. And we have to be sure, because if not, you are just going to condemn the child to not taking that particular antibiotics. I mean, not be that it may not actually be that the child is reacting to the antibiotics. So, which is why I really want you to be with a pediatrician and who can manage the child properly. So that's my recommendation. Um, Blister in the hands and legs. Very unlikely to be antibiotic reaction. Sound like that child's original illness has to do with something that has to affect the hands and legs. There may be other issues going on with that child. Very unlikely to be a reaction. So I think that diagnosis needs to be revised. I could think of other things that could cause blisters in a child who's already having fever and all that. So anyway, make sure you're seeing a pediatrician. Trisha is saying your baby was in the hospital for a whole week. Okay. They even swapped to Rocephin. Okay, good. And it kept spiking. Yeah, so there are what we call a fever of unknown origin. It's a condition where children, you are treating the child and the child is still having fever. So sometimes what we need to do is to stop all the antibiotics, stop all the drugs, and go back and reevaluate the child. And maybe we've not yet picked up the cause of that child's fever. Children can also have what we call drug fever. You've given them too much drugs, especially if you two have given a lot of drugs before you come to the hospital, they will give more drugs. Children can actually have fever from drugs, to be honest. And actually, the solution is actually stop all the drugs and then decide again. So you need to go back to the hospital. Uh, yeah, you need to go back. I'm not surprised your child is vomiting or stooling, because a child who has been on antibiotics for 1 week, the side effect of those drugs is vomiting. Almost all the drugs have nausea, vomiting. So whenever they ask us in medical school side effect of medication, if you don't remember anything, you will start with nausea, vomiting, because virtually all drugs we have nausea and vomiting and maybe diarrhea as side effects. So it's a common side effect for medication. So the fact that child has been on drugs for so long, and also the fact that when you get antibiotics for so long, you actually clear out the good bacteria in the GIT, in the guts, and so sometimes that can also lead to diarrhea. So that's why sometimes you actually need to consider whether we need to actually stop the drugs and reevaluate. But actually, this is not an online thing. This child has to be in the hospital setting. We have to be taking care of this child in a hospital setting. And I hope for Chizoba and Tricia that your babies are seeing a pediatrician. That's very, very important. Those children, the kind of information you're giving to me about them, they need to be under the care of a specialist. So if you are in like a private hospital or hospital that don't have a sitting in pediatrician, I would recommend that you move to one that has a pediatrician. Even if you don't know, you can go to a teaching hospital, because those are the kind of children that we want to be seen by the specialist. So I hope that's helpful. All right, let me come back to Facebook. Sorry, Instagram people, I have to come back again to Facebook. Oluranti Ojene, yeah. Say good evening. My son of 4-year-old is always falling while sitting or standing. Okay, so enabling for seizure. So is he having the seizure? So is the fall a seizure? Because we need to know which one. So if the child is always falling, is it because the child is having a seizure, or the child is falling even when the child is not having a seizure? There are two different things. And why is the child falling? So if your child is having seizures, your child should be under the care of a pediatrician. Okay, your child is just trying to walk. Okay, I get it now. So obviously this child is a child who has developmental delay. Does your child have cerebral palsy, or is it just global developmental impairments or global developmental delay, like we used to call it? And so there are more information you need to tell me about your child. But unfortunately, I know it may be difficult to do the back and forth on that. But from the little you've told me so far, then we're not surprised that the child is falling. Obviously, your child is not yet walking at 4 years. That tells me this child has significant developmental delay, and maybe the child even have cerebral palsy. You didn't tell us that. So if that is the situation, then yes, we know the child can fall. So the child having physiotherapy, and that's number one. So is the child falling because of the motor disability, the fact that the child has physical disability like cerebral palsy, but the child can also fall because they're having seizures. So you need to be sure that this fall is not seizure related, because your child is already on medication for seizures, and we may need to adjust the dose of that anti-epileptic medication. So, but bottom line, your child should be under the care of a pediatrician, preferably a pediatric neurologist or a developmental pediatrician, and then we can have that conversation. So I hope you do see one of those pediatricians regularly. If your child is on anti-epileptic medication, you should be seeing doctors minimum every 3 months, minimum. If your child seizures is well controlled and no seizures, maybe we can stretch it a bit, but maybe 6 months. But most of us would like to see that child every 3 months. In fact, sometimes we want to see the child every month. So we need to adjust medication. And the reason why I'm saying this is because I see a lot of parents who think once the child has had seizure and they've put you on seizure medication, you can just go home and that is the end. No, that kind of treatment is we are working together for 2 years minimum, and we're working together where, so it's a child we see regularly. It's not something you will just go and be buying drugs when you feel like buying drugs. No, you have to be seeing the pediatrician every 3 months minimum, and they may be adjusting things. The child may need physiotherapy. There may be other things that the child needs. So it's very important that you are seeing your specialist. And if you don't know where to go, uh, most of our government hospital has what we call neurology clinic, where we see children with epilepsy, developmental delay, and all that. All right, Ogonna say your child's breast milk is not satisfying the child. How do you know the breast milk is not satisfying the child? Under producing supplement. Okay, how do you know breast milk is not satisfying the child? I like to ask that question a lot because I like to know how parents know they are under producing, they are not, yeah. So just let us know, and then I can give you my own view as well on that. Okay. All right. And the fact that you have, you maybe initially you underproduce or something, you will always underproduce unless you keep giving formula anyway. That will also reduce your breast milk production. But if you want to really make sure you're breastfeeding, then the best actually is to actually breastfeed your baby more. And the more you breastfeed, the more the milk will flow. It's just simple demand and supply mechanism for breastfeeding. So anyway, but if you have any updates on that, feel free to put it, because I'll be able to tell you how we know whether your baby is getting enough milk or not. But I always want to know how you know first, then I will know how to answer that. All right, Omeke Abigail say, what can make a baby's hand to look as if soaked inside water? What does that mean? You mean the baby's hand, does the baby have rashes or wrinkle, peeling? I don't know. So a lot of mothers like to so I don't know what you meant by hand soaking water. So is the baby's hand having rashes, or is baby's hand peeling, or is it like wrinkled? you know, and mostly when he's sweating or crying. Yeah, if somebody is sweating or crying, then there is water already on their hands from the sweat and from the crying. So I don't see that as a big deal. But anyway, I'm not worried about that. Since you already know that this is something that happens when the baby is doing something in particular. So and your question is actually not very specific. It doesn't really tell us much. So I'll just say just leave it alone and just leave baby. But just make sure you are also not giving the child opportunities to be crying and crying all the time. So and make sure the child is not sweating and sweating all the time. Make sure the room is well ventilated. Make sure there's fan, there's AC. I don't know why people felt that children should not use fan, they should not use AC. That's not true. That's not from the pediatricians. That's from the experienced mothers, old wives' fables. So let your child be cool, be comfortable. That's what we want. All right. Patricia say thank you, doc. I'll take him back to the hospital, although I prefer to take him to another hospital to see a pediatrician, but I'm worried they wouldn't know the medication already used on him. Okay, yeah, there's a way around that. You can go back to the hospital you've been, then they can write to what we call a referral letter or a medical report. So they will write out all they have done. Ideally, they should. And then you can now say, go and see the next specialist. There's nothing wrong with referral. In medicine, knowing your limits is actually one of the most important things that make you a safe doctor. No doctor knows it all. So if I see another, if any of you ask me a question, I'm not going to treat you. I'm going to send you to my colleagues who can treat you. That is actually what makes me a safe doctor. I don't say because maybe I know it's not conjunctivitis, I can treat it in children, so I should treat it. No, I won't treat it in adults. So I won't, because that's not my job. I mean, developmental pediatrician, that is my, I'm not just even a pediatrician, I'm a developmental pediatrician, so I like to stay by my calling. So if I see somebody who has a heart problem, I'm not going to treat that child. I'm going to refer that child to my colleague, maybe Dr. Shokunbi, who is a cardiologist, because she knows more about that condition than I will ever know, because that is not my specialty. So the same thing applies. So every doctor, even for our general doctors, they don't have to treat everything. Once a general doctor is treating a child and they notice that this child, you've treated a child for 1 week, the child is not better, it is time to refer to the specialist. There are doctors that specializes in treating infection alone. That's all they do, immunologists and all that. They will be the one, because this child has had fever for 1 week, this child has been on multiple antibiotics, this child has had rocephin, which is a third generation cephalosporin, which is one of our, once we start getting to rocephin, there are not many more other drugs after rocephin that we can give children. No, that's it. There's nothing much more after it. So once you've treated children with that kind of medication and the child is not better, then you really need to be thinking, what else am I missing? What else have we mixed? It may even be something that needs something as simple as erythromycin, or maybe not even a very complex antibiotics, which is why we do those cultures, and we somebody may just have another look and they will be able to pick up what is wrong. So there's nothing wrong. It doesn't mean the doctors are not good, it just means that they've gotten to the limits of what they can do and they want a specialist opinion, which is the advantage of, which why I said go to a teaching hospital. The advantage of being in a tertiary level hospital is that when you are with one particular person and they think, I want the input of the other people, they can always call them. Everybody can call. We can call all the whole specialists to come and have a look at one child. So sometimes you have like 5, 10 different specialists looking at the same child, and everybody is looking at it from their own perspective. So that is the advantage of those kind of setting. So we don't need to go to another hospital to get another specialist, because all of us are already in that specialist center. So that is the advantage of teaching hospitals, so, or tertiary level hospitals. So if a child has been sick for long enough and the child is not well, you need a tertiary level kind of input, and there's nothing wrong with that. So feel free to meet your doctors. If they are very good, they will write. If not, just go to the hospital. The other doctors can always call them and ask them what they've done. If you think all the writing and bureaucracy may take time, just go. The most important thing is this child is being cared for, because I'm not happy that the child has been sick for 1 week, taking antibiotics for 1 week, and the child is still having fever. Then we need to really have a look. We still have time now, so before things gets more complicated. So that's why you really need to get care quickly. All right. Granny's Pure Honey. Okay, what the name? My baby is still in liquid poo, but it's very active, drinks water very well. Always starts every question with the age of your child. So Granny Pure Honey, tell us the age of the child. The age of the child is very key for us to know whether we should worry about your child or not. So I'll wait for you to update your question with the age, and even for the pool, how many times in a day, how many times has the child passed water stools. There are lots of issues that we need to unpack. All right. So Omeke say no, just the finger size. Omeke, I think your baby is just sweating on the hands. I don't think there's anything wrong with that baby, so don't worry about the baby. Somebody at that winner say, what is the cause of added noise? That's not really it's just like saying, what is the cause of your teeth or cause of your hand? Adenoids are normal structure in the body. We all have adenoids. At least when you are a child, you should have your adenoids. So adenoid, I guess what you want to ask is cause of enlarged adenoids, like they become too big and cause problem for the child. If that's what you are asking, yes, I can answer that part. So there's nothing that is causing it. Sometimes it just happens. So usually adenoids are normal structures in the body, but in some children they are very big. But the good news is that as children gets older, the adenoids tend to shrink and they get smaller. Actually, by time 4 to 6, some of them actually have shrink completely. But some children have it very big, and they, because the adenoids are around what we call the airway, the opening into the airway, the trachea. Just don't worry, don't forget all the medical jargons. Just remember airway. So the adenoids are around that area where the child is breathing through. That's what we call the airway. And when they are very big, they kind of narrow the airway. So sometimes when the child is sleeping, they can suddenly stop breathing because the adenoids have kind of closed the airway. So then the child wakes up and starts to try to breathe. And that's why children, when they are breathing during the day, for children with very big adenoids, they tend to mouth breathe. They are breathing with their mouth. You can hear them breathing. Usually, you shouldn't be hearing anybody breathing. Breathing is one of the noiseless kind of activity. I am talking to you and I'm breathing now, but you can't hear me breathe. So when you start hearing your child breathe or they are opening their mouth to breathe, it may be that they have adenoid, and tonsils is also close to the adenoids. They can be enlarged. And not, apart from the fact that they are enlarged and they can block the airway, they can also get infected so easily. So such children tend to have recurrent infection, tonsillitis, full of pores, and then they'll start having fever. Then we have to treat them with antibiotics, and by the time you finish treating, at the next time, maybe 1 or 2 weeks, they're back again. Some of them can have up to like 6 infections in a year or more. So when we start getting to that point, the ENT doctors, who are the specialists that take care of children with enlarged adenoids, they just go and take it out because there are other organs in the body that can do the work of the adenoid. So we see how the spleen. So the adenoid is one of those group of organs we call lymphoid tissues. So basically, lymphoid tissues, their role in the body is to produce antibodies that protect us against infection. So we'll always like to keep them there. We know they are very useful because they produce a lot of um, agents that fight infection in the body. But there are many of them. So we have many of them scattered all over the body. So if they are causing a lot of problem, we can just take it out. So they usually will take it out, and sometimes that's the end of the problem. So if your child has enlarged adenoids, or your child is having recurrent adenoids, tonsils infection, or your child is struggling to breathe at night or even forgetting to breathe, what we call obstructive sleep apnea, you have to see the ENT doctor. Those are the indications for surgery. We don't operate every child who have enlarged adenoids. If it's not causing any problem, it's just big, but not causing any problem. It's not getting infected. The child is not, maybe the child just know, but the child is otherwise well. We will leave it alone because we know that with time it will start to shrink on its own. But if it is causing problem, infections, recurrent infections, apnea, sleep apnea, we have to do an operation and take it out. It's not a big deal of an operation because a lot of parents are scared when they hear the word operation. Most of the time, when they do the operation, the children are eating the same day or the following day and they are home. So, but obviously, sometimes for whatever reason, some children may react to the anesthetic. So, I understand why there can still be a little bit of concern, because you never know who is going to have an allergic reaction to anesthetics agents and all that. But otherwise, it's one of those simple things that the ENT doctors will do. But the ENT doctors are the ones to tell you whether your child needs surgery or not, because there are criteria that they have for deciding whether they need to operate a child or they don't need to operate a child. So I hope that's helpful. All right. All right, granny zoning. So your child is 1 year old, poo 4 times a day. Okay, so if your child is having watery stool 4 times a day, that's diarrhea. So what you need to do is to buy ORS. There's ORS in virtually all the pharmacy stores, and they always come pre-packed now with oral zinc. So mix the ORS and keep giving the child, and also give oral zinc. Oral zinc usually is about 20 milligram, or sometimes it can be 10 milligram, but between 10 and 20 milligram, it doesn't matter. You just give one tablet every day, one tablet per day for the next 10 days to 14 days, and make sure you give the child ORS until the diarrhea stops. So when the child is having diarrhea, we're not worried about the diarrhea, we're worried about the complication of diarrhea, which is the dehydration. So the most important thing is to replace the water that the child is losing, which is why we give the ORS. But it's not only water the child is losing, the child is also losing what we call electrolytes, sodium, potassium, bicarbonate, and the rest of them. So that is why it has to be ORS, because ORS has a potassium, it has a sodium, and all that. So that's what you need to do. Give ORS, give Oracin. Don't give Flagyl, don't give antibiotics, don't give tetracycline, don't give diarrhea stop, don't give all those rubbish drugs. Just give ORS and oral zinc. But more importantly, pay attention to the hygiene around the child. Make sure they are washing their hands. Make sure you are preparing their food fresh. Make sure you are not giving them bottle to drink like cereal or anything. They should eat all their food from plates and drink from the cup, not from bottles, and everything should be washed. Your hands will be washed before making food, after changing diaper, just general hygiene. And most of the time, within a few days, diarrhea will stop. You don't need to stop the diarrhea to stop by itself. The most important thing is, as long as the child is having a watery stool, you are giving the child water, the ORS, so that the child doesn't get dehydrated. So I hope that's helpful. Phenomena say, can I give my son of 10 months old multivitamins? You don't need to give any child multivitamins. Give your child fruits, give your child vegetables, let your child eat well. Go to our group, read about what we call how to how to feed your child for the first 2 years of life. Read about complementary feeding. You will know how to mix food. All the vitamins your child needs, we prefer that they eat them rather than they take them as tablets or syrup, whatever. It's better your child eats their vitamins rather than take it as drugs. Unless it's a child who does not eat vegetables or fruits at all, then you can use that as a stopgap measure while you are encouraging the child to eat their fruits and veggies. Otherwise, all the vitamins the child is going to get is through their food. We give vitamin A drops because we don't want children to get what we call blindness from vitamin A deficiency. But otherwise, all the other vitamins, let them get it from the food, and let them play in the sun, and they will get the vitamin D as well. Just a minute. Okay. Let me see whether I have any question on Instagram. Okay, Instagram, I think I've answered all your questions. Omike Abigail say, does a child of under 1 year get typhoid infection like a child of 11 months? Let's just start by saying that anybody can have typhoid fever, but please, the children are not having all this typhoid. All this one in Nigeria that everybody is getting labeled with malaria typhoid. It's not true. Most of you don't even know what it is to have typhoid fever. Most people are walking up and down, taking themselves to the lab and saying, test me for typhoid. You don't have typhoid, because if you have typhoid, you'll be lying down on the hospital bed. It's a very serious illness. So don't go borrowing all this malaria typhoid into the children. So please, no child is having typhoid. Don't take all those malaria typhoid diagnosis from any hospital where the only diagnosis they give you is malaria and typhoid. Just run from them. It means they don't know what they are doing. They are not most of them are even either they are not trained doctors, or they are they've not been updating themselves. And the so-called wider test that people do is actually not how we diagnose typhoid fever. Okay, so let's just leave it at that, because okay, maybe actually I need to come and talk about malaria typhoid because people like to talk about it a lot, especially Lagos Nigerian people. So most people don't have malaria and typhoid together. And I'm talking of adults. Those of you that go around saying I have malaria, typhoid, in fact, it's almost like one word now in Nigerian terminology. Whereas there are two separate illnesses and they don't tend to occur together. God is not wicked. I will be giving you both malaria and typhoid. So it's not true. So most of those everybody's doing malaria typhoid tests instead of going to the hospital, getting a doctor to examine you properly. No, and then please don't start with children. I hope nobody is taking their child to any hospital where they are giving your children malaria typhoid diagnosis. Please don't. If your child is ill, go to a government hospital. Go to a hospital that has a pediatrician so that they won't go and label any. I don't expect any child who is under 1 or 11 months to even be labeled with any typhoid. Where is the child getting it from? Unless the mother has typhoid fever herself and it's not paying attention to hygiene, and or the child is buying food that is cooked by other people, which is why we say you should cook your own food, boil your water. You get typhoid fever from food and water. So if you're paying attention to all those hygiene and all that, you're not going to get typhoid fever from anywhere. So, and it's a very serious illness. So avoid hospitals that every time you go to hospital they label you with malaria typhoid. Some of you don't even go to hospital anymore. You just go and test yourself. And the lab, they already know that's what you want. So they always have your white must be high. They don't even do the test properly. And it's not just the one wider that you do at the beginning that gives you a diagnosis of it. It is the rise in the titer. So we do it now, then you do it in a couple of weeks, and then you see a rise. Then that is when you actually know the person has typhoid. Not once off you've done it and So let's not even go into that discussion today. But it's just one of those things that piss me off, because I know that most people that are labeling people malaria typhoid, they have no clue whatsoever they're doing. All right. Ada Winner, I think I've answered your question about adenoids. I hope you listened. If you were not listening when I answer your questions, you can watch the recording, because I actually took my time to answer your question extensively. All right. So, Afolashade, is adenoid the reason a child can hold his breath for some minutes? So, when you say the child is holding his breath, is the child holding his breath deliberately? Because anybody can hold their breath if they want to. So, and that doesn't mean the child has any adenoids. And also we have children who have what we call breath holding attacks. So breath holding attacks is a situation in children when either they get hungry or they've been crying for so long, and then they suddenly just stop breathing for a few seconds to a minute, and then it's as if they passed out. So we call it breath holding attacks. It's a very, very dramatic thing, but there's nothing wrong with the child. It's just a child who is very upset. There's always a trigger. Usually the child is very upset and they've been crying, and then they will suddenly stop breathing, and then they kind of pass out, and they start to breathe again. So that could be a breath holding attack. It's really happening in children who have some excessive emotional reaction. Usually when they're upset, they have been crying, or you've upset them quite a lot. Yeah, so that's that. So children usually will not hold their breath. So for children with adenoids, they don't deliberately hold their breath. They don't even know about that. They just stop breathing because the adenoid is closing the airway. So that does happen during sleep. So that's the difference. So a breath holding attack doesn't happen during sleep. It happens in a child who is wide awake, who is very upset, who has been crying, and then suddenly stop breathing. That is a typical breath holding attack. For a child with adenoids, they are sleeping and then they suddenly stop breathing. That is the obstructive sleep apnea. So there are two different things. They are not even closely related together at all. And depending on the age of the child, so a child holding their breath must be holding enough to be able to hold their breath. So usually the older children can hold their breath while going underwater for swimming, for example. So that's a different thing. So you have to be very specific. Is a child deliberately holding the breath, or is it a child that suddenly stop breathing? In which case, is it during sleep? Then adenoid could be a possibility. Or is it in a child who is already awake and crying and making a lot of noise and then suddenly stop? Then that would be breath holding attack. So there are two different, and we don't even have any confusion at all. We don't even confuse the two together at all. It's because they are both very dramatic and so obvious situations that we can always know what happened. Okay, I guess that's the last question I have on StreamYard. And I don't think I have any question anymore on Instagram. So thank you so much, everyone, for joining, for watching. If you still have any questions, no problem. go over to our Facebook group. I'm sure you can see the scroller on my page, and then you will see how to get to our Facebook group. Ask the Pediatrician Facebook group. You can ask your questions from us every day, Mondays to Saturdays. I see a lot of you tagging us on posts by other people that they've asked random people. One thing we can assure you of is that when you come to ATP, you're going to get answers that are validated, that are based on the pediatrician's opinion. Not and we don't like to comment on all those public posts, because health issue is not a democracy of opinion. It's not a democracy of who get the most likes on the answer they gave. It's so amazing how people, well, they meant well, but they're actually leading people wrongly. So, and please, I beg you, if you are not a professional, if you're not a health professional, avoid giving answers to health issues by parents. It's wrong. I know you don't mean to be you don't mean to harm the child, but you can be guilty of manslaughter by indeliberate harm if you get to court. Yes, and I meant that with all sorts of responsibility and seriousness. Some of you give answers that are so terrible, and it just, it's not the best. So I would say, on a just general caution, just avoid giving people answers on health issues, so unless you are very sure what you are going to give them, like general health issue, like, okay, breastfeeding is good and all. But when you say my child has this particular thing, or this child is really having some rash, or having don't tell them go and use that cream, go and, oh, that's what the doctor gave me the last time. Don't copy and paste treatment. They are not always the same. Even though they look the same, it doesn't always have to be the same. And I know many of you don't like me to say that, but it is not the same. And so please, let's, even though we're trying to help people, make sure you direct them to the right people to help them. So you can tell them go to the hospital. You can tell them go and ask the pediatricians on our group. It's better. Our group is not like a group for, it's not about it's not like social media for likes and stuff like that. It's about really helping real issues. So I really, really want to implore us to avoid us telling people what to do, because you may mean well, but you can cause harm. And one of the principles of medicine is, first of all, do no harm. If you can't help somebody, don't harm them further. Even as doctor, that's one of our what we call ethical principles of medicine. Do no harm. If I cannot help your child, I'm not going to harm the child. So it's very important that we don't. And I see a lot of people doing that. Even though they think they are very nice and answering questions, you're actually causing harm to the child, and it's not good. So just take it as a friendly advice not to do harm. And if you don't know, you don't know. All of us have our specialties. So the same way I will know. You don't come and ask me a question about your car. I have no clue. I'm not going to tell you to go and put salt or sugar in your car. I'm not a mechanic, so I don't know what is wrong with your car engine. And if I tell you to go and do that, and you do that because it's Dr. Bemi, your car will get nothing, But the good thing is, at least you can buy a new car. Your car is replaceable. But your child is not. A child is not replaceable. And once life is gone, it's gone. So that is why we should take, and that's why it's painful when we see parents taking advice from just anybody when it comes to the health issues. You don't take advice from anybody when it comes to your car, even your clothes, even your makeup. You take from makeup artists. So why will you now take something that is most precious to you, which is your children? You go and take advice from just any random person. We should stop doing that. Our children are more precious than our cars and other things that we don't even take advice from people who don't know what they're doing. So we should always make sure we take advice from health professionals. I don't know why I'm actually saying this, but I guess maybe God wants me to say that because somebody is going to get into trouble doing that. So please don't take advice from people who are not professionals. And I mean real professionals, not people that are your household neighbor knows that, all this, you know what I mean? People who don't go to hospital, who did not go to school to train, but they're trained, don't go and get into trouble with them. Okay. So if you have any question, one of the things we promise you on ATP is that come and ask us. And we will always tell you, even if it's something we cannot solve, we'll tell you this is an hospital case, go to the hospital. because it's not about popularity, it's not about democracy, it's not about opinion, it's about the health of a child. And children are so precious and they can go from A to Z very quickly. So it's very important that you are getting your information. And like I started with before people start to ask questions, if you need to ask yourself, should I go to hospital or not? Just go to the hospital. Don't wait to ask anybody, because it's rather safer and better to come to the hospital and we tell you everything is fine, all is well, go home. We're not going to abuse you. I know some of my colleagues don't, and we're working on ourselves. But we're not going to say it's wrong for you to come to the hospital. No, it's okay to come to the hospital. Even if it's okay to just come and everybody tell you, oh, it's good, everything is fine, thumbs up, go home. It's better than to stay home and then the child is closer to dying and then you're rushing. And then some of us will blame the hospital for why the child died and all that. But we won't blame ourselves for coming so late. And I always tell people, we are not God. We don't heal. We only care. It's only God that heals. And the way to help us that are not diviners and oracles, is to come on time so that we have enough time to quickly do what we need to do and get the response. But if you come so late, sometimes late is too late. So sometimes we just can't do anything. So please come to the hospital. I don't know why I'm saying this, but I have to finish this a message for somebody. So go to the hospital on time and don't ask your friends. Your friends are not your doctors. They are not your. The number of times people will tell me, oh, somebody said, and who is this somebody? Somebody who should not even be talking to you about health issues in the first place. So don't quote somebody says. If the person is not a doctor, is not a nurse, is not a professional in health issue, you don't even need to be saying somebody say. Who is the person? The person has no right to advise on health issues. And when it comes to children, please stick to the pediatrician's advice, because some other doctors also don't know how to treat our children. And no ill feelings, but everybody has their roles, and that's why some of them you go and meet the pediatrician. So please, let's be very, very careful. Thank you so much for coming, and I think I need to go now. Uh, Somebody in here said my little niece took 3 month vaccine, been feeling pain. Yeah, it's okay to feel pain. Just give the child paracetamol. Give her paracetamol to reduce the pain. Yeah, the injection they give at 3 months is a deep intramuscular injection. It's about 5 vaccines in all. I hope that is painter. And yes, it can be painful. So you push just to be gentle. Some of us children have just taken vaccine, just be throwing them up and down. No, please. That area is sore. You just imagine yourself, somebody give you an injection. So it's always painful. So be gentle. Don't be holding the leg. That's not the time to back the baby, because you're going to be putting pressure on that leg. So just make sure you hold the baby with that consciousness and be gentle. And then give paracetamol. You can give paracetamol every 6 hours. So you didn't tell me the weight of the baby, but you can work it out. It can be written on the pack of the paracetamol, so just work it out. And you can give the paracetamol every 6 hours for the next 2 to 3 days. It will help with the pain, it will help with the fever, but also be gentle and you carry the baby. You can also apply ice pack on the sides. Just put ice cubes, wrap it in handkerchief, tie it, and just put it gently. 1 or 2 seconds, take it out. Another 5 seconds later, put it intermittently like that. It will help. So that's all you need to do. All right, thank you so much, everyone. So I'll see you again on Thursday, where we'll be doing a teaching on something related to the health of our children. But like I said, if you have any questions, feel free to go to our Facebook group, ask your questions, and I'll be able to answer you. Thank you so much. Have a wonderful evening, and it is bye-bye from me. Bye-bye.